Hello, Dr. Lydia Trauth here. Today I want to talk about testing. I want to talk about antigen test, PCR test, and how to get free home test. Okay, so a lot of you have kind of said, okay, well, I took an antigen test at home and it was negative. And that's good, but there's a lot more to it than just that. And that may or may not actually say that you have COVID or not. So let's kind of talk about antigen testing. Antigen testing is the rapid testing. That's the one that's done in 15 minutes and gives you a positive or a negative by having like one line or two lines. When it comes to antigen testing, they are really accurate about 48 hours into your symptoms. So if you're on the first day or maybe even the start of the second day, they may or may not be very accurate because you have to have enough viral load in order for them to actually flip positive. So if your viral load isn't high enough, then they're not going to turn positive. And often your viral load is a little bit lower earlier on in your symptoms. So at 48 hours, when they compare them with PCR, they're about 90% accurate. But prior to that, they're not quite as accurate. So if you get a negative test and your symptoms just started, you have two options at that point. Isolate yourself and go get a PCR test, or isolate yourself and wait a little bit longer and then retest with another antigen. That's why a lot of these kits actually have two in it. It's designed to do that. You can test one, and if it's negative, then you can wait a couple of days and test again and see if it's positive or not. Either way, if you have symptoms, you need to stay home and stay isolated, okay? Now, the PCR test, we do have PCR tests, and that's been really readily available through our hospital. Unfortunately, because everybody in the country is needing antigen tests and PCR tests, that's making it a whole lot harder for us to get. So our clinic has a shortage of antigen tests. If someone has a magic unicorn that can get us some antigen tests, we would love to know about it. And the hospital is running short on PCR tests. They've ordered them, but they keep not arriving. So what does that mean? It means very soon it may take longer to get a result, at least if we're going through the hospital. So if you have to stay local, it may take a little bit longer. I think Baptist is maxing out most days just because there's been such a demand. There is a clinic in Little Rock that basically just does COVID testing, and it's called Infinity Genomics, and it has several different locations in Little Rock, North Little Rock, and Benton. So if you're able to drive to those areas, that's fine. Basically, it's just drive up and they get your information, they do your test, and in 48 hours you have a result. So that's an option. What's the right choice? That's a good question, and one I don't always have an answer for. If you feel sick, the answer is stay home. Yes, you should probably test because you don't want to be passing this to other people. And you say, well, okay, well, Omicron's more mild. Yeah, but it's a whole lot more contagious, and it's not that much more mild. I think you can look at our hospitalization rate and go, okay, this is the highest hospitalization and ICU rate we've ever had. So a lot of people are getting sick with it, and we don't like that. Best ways to protect yourself: if you haven't had your COVID shots, get your COVID shots. If you haven't had your booster and you're over 5 months out from your Pfizer or Moderna, or over 2 months out from a Johnson & Johnson, go get a booster. And hopefully that will help. And then, because we are having a shortage of tests, but the government seems to have plenty, you can order your free test. So you can go to covidtest.gov, or you can go to the United States Postal Service at USPS.com and order your 4 free COVID tests. And if you can find COVID tests in the grocery store, then I think starting this month, your insurance company is supposed to start reimbursing you for up to 8 tests a year. So hopefully that helps a little bit. If one caveat I kind of want to give you is if you do plan on traveling anytime in the next 90 days, then you, especially if you're traveling outside the country, you're going on a cruise or something like that, you're probably going to need proof that you had COVID. And so that may be worth a call to your doctor, even if you do a home test, so that we can document the fact that you had COVID, so that later on we can document that you recovered. Okay. Y'all take care. Let us know what questions you have, and keep us in mind if you know of a place we can get a large supply of antigen or PCR tests. Okay, y'all have a great day.